I kind of wanted to just get maybe a quick brief overview on the software and then repeat it again after lunch so that those that are like need a little bit extra repetition will be able to do it. So I click and I go into surgical guides. This gives me some options here. I always start with bringing in the cone beam first. So I click this middle one and I'm going to say import patient CT scan. Now, on the desktop, we loaded a few case examples that we're going to be playing with today. I want to start with this number 13 single unit surgical guide. So if you guys go into this folder here and open it up, it's going to recognize that there's a CBCT image inside of here. So we're loading in our CBCT and we're going to load it. Okay? If I've lost anybody, Dr. B is going to be walking around. All right, so it's going to ask us, it's going to say, hey, I found, this is the surgical guide or the cone beam that you're interested in bringing in. You don't need to mess with this at all. I just go and hit OK. It's going to say, yep, that's the CBCT that I want to bring in. Now, the first thing it asks you to do is, do you want to crop or rotate the CBCT? So why would we crop a CBCT? It's going to reduce a little bit of file size by chopping out unneeded information. You don't have to do that. I would say a lot of times I just hit next and just load it in because I don't really care. But these little sliders here will allow you to crop three-dimensionally an image. We're doing number 13, so obviously we're doing a maxillary arch. So don't worry about if you guys don't want to do this, but I'm going to just kind of go ahead and show you how you might crop a little bit. And you can just kind of select a smaller volume because we're looking at just the upper jaw. We're doing number 13. So I cropped a little bit. I hit OK. And it cuts off all the excess CBCT data that you might not want. Now it's going to ask you, do you want to import an additional surface? So this is where we bring in our STL. So this is where the magic happens. So if you guys click Import STL Model, and you go back to your desktop, and we find where that case is, because I've put everything in here that we want. Let's bring in the upper scan. So I've got an upper scan and a lower scan in here. Let's bring in the upper scan, because this is the information that we're actually using. It'll give you a little window over here to verify that the scan that you want. We're doing number 13, this edentulous ridge right here. So we're going to grab in our upper scan. Now, if you guys watch here, it's going to import it, and this is where the magic is going to happen with the alignment. So we talked about automatically aligning. We're going to tell it that this is a maxillary jaw, and this alignment process is the automatic portion. So watch what happens when it aligns this STL to our CBCT. It's going to tell you, please confirm, right? We talked about this before. Don't trust it. Go and confirm it. There's multiple things going on in this screen, and I'll kind of break them down here. At first, when you look at this, you're going to be like, man, there's just a lot of information here. There's various ways to view the files. Part of it is just practice and getting used to everything. Everything right down in here in these black boxes is different views and slices of our cone beam. Everything right here are the panels for doing various tasks. And in the very top right corner is the module that you're currently in. So notice we're in model editing. Remember that module? For some reason, the software moves you from surgical guide to model editing every time. Kind of annoying, but a lot of times you need to edit your model at the beginning anyway. But if you look up in here before lunch, I want you guys to understand, clicking this upper right area changes the module. So we talked about different modules, crown and bridge, denture. The one that I'm most interested in today is called Surgical Guide Advanced. I told you guys, let's just get used to doing the advanced module. It's the one to go to. And I like having that, being in that advanced surgical guide module, because that way when you're in that module, the relevant tasks are all going to support building a surgical guide, not building a denture. The panels on the right are going to be more geared towards surgical guide creation rather than other things. How do we verify the alignment? This is how I do it. The first thing I do is I take this slider and I look at this green line in relationship to the teeth as I slide this up and down. And you can see that green line follows the cusp tips right along the crowns. You guys follow that? That green line is the outline of the STL. Does anybody have any questions about how I'm viewing right here this alignment? All I'm doing is confirming that the alignment between the two were correct. So I verify it in a top-down direction, and then I verify it in a slice direction. And you see that middle right here? If you look at this middle one right here, as I'm sliding this across, that green line is following the outlines on my cone beam. So all the crowns on my CBCT are matching up with that green outline of my STL. Now I know if this is the first time you've seen this software, it looks a little daunting. It looks kind of like, somebody with a lot of computer knowledge built this software. Once you get used to it, it's pretty intuitive.
Two questions.
Yep.
Does the field of view of the CBCT does matter on this situation? And the second one is the STL file from your scanner. Let's say if you're doing 13, do you want to do just a quadrant or do you want to do full arch?
With the intraoral scan? So I would say the more scan data from the STL that you have, the more accurate the alignment might possibly be. So let's just say you scanned a quadrant and you want to align it. It's only going to have maybe 4 teeth to really align, which might be totally fine. But when you get cross-arch alignment, you're going to get a much accurate stitching of what's really happening in real life alignment. So more data, I think, is going to be better for stitching. For field of view, for the cone beam, you only really need to scan ideally the arch which you're working on. Some practices, they'll send a patient in to get an upper arch scan only, or a lower arch scan only, or a quadrant. I've tended to find myself just defaulting to just dual jaw scans for everybody, because I don't know how many times I've told my assistants to go get a scan and they did a quadrant here, but I'm really needing it down here or over here. And so my solution to that was that, guys, every patient gets a dual jaw scan. So, that's up for debate with.
And a bite.
What?
And a bite.
And a bite, yeah.
They'll forget the bite. They'll go scan the patient, forget the bite, and then you're doing an implant here and here, and you wanted to relate those in the software. You do the same. Right?
Yeah, for sure. So that's how I kind of handle that.
If I have cropped out the CT just to reduce the data, and at this point I realized, I needed the opposing arch in order to see where the occlusion is coming in. How do I go back and change?
So that's a good question. You don't need that CBCT data to get the opposing, because you're actually going to get the opposing from the opposing arch in the STL format. So we only imported the upper jaw of the STL in here. So we still have to drop in the lower. So don't worry about the cone beam data being cut off. Okay? All right. I don't want to skip alignment before everybody understands that.
Let's say if you're doing one on the upper and one on the lower, then it's 2 separate files, right? You cannot do upper and lower because you selected maxilla versus mandible in the beginning, right?
Yeah, I imported my upper STL and I told it was a maxillary one, and I haven't imported the lower one yet.
So, but you can't do both together.
You can, actually, you can. Yeah, no, you definitely can. Yeah, so you can control select 2 and drop them both in. And often I do that, and then you just have to tell it which each one is. Yeah. All right, any questions on alignment? You can see how it doesn't really require you to do anything. You just have to verify it. And we talked about scatter being, problematic. So green outlines are that STL. So anytime you see that green outline, that's an outline of your STL. and you see that, okay, it's well adapted to that cone beam. So I'm confirmed that those things are aligned properly.
So what if it's not aligned?
Yeah, good question. So yes, if it's not aligned and you're like, this is off, now you got to figure out why. So is the why because the patient moved while they were scattering and it's a grainy image? Rescan new cone beam. Is it not aligned because there's so much scatter in the cone beam from zirconia or metal? Well, a rescan's not going to solve that, right? Now you have to think about, can I manually align this? Which, risky, right? Because now you've introduced potential errors in the process. That is a complex topic because taking those high scatter cases requires a different way to align it, and that's where the scan appliance can come in. So if you guys ever heard of, the dentures with the radiographic markers, it's because they don't have teeth to align. But if they have a bunch of zirconia crowns, sometimes you have to make a tray with impression material with radiographic markers outside the tray and use those that are away from the teeth. Do you follow that? So you have to creatively solve those problems, and it's a little bit more complex to do that. That's why, thankfully, 90% of patients have some natural teeth to stitch to, and you don't have to worry about that.
Yeah, most of the time you'll find that these will just stitch.
Yeah.
They'll stitch correctly.
Yes.
Like I haven't run into that yet.
Yeah.
You know it can happen, but the vast majority of cases it's pretty good.
Yeah. And the software algorithms, that best fit matching does work really good, so you just trust it. And you verify it first. Yeah, for the denture you have to dual scan. Yeah, so you have to put some sort of radiographic marker on their denture, like glass beads or composite or gutta percha.
And scan the denture separately.
Yep, and scan it separate. Sometimes your CBCT has the ability to scan that thing. That's a common one. Yeah. All right. So I wanted everyone just to kind of get a little hands-on with the software and do a brief overview because there's like some of this is setup, right? And it's really important to know the proper setup before we jump in and I say, okay, let's start doing a guide. And you're like, wait, you lost me on setup. So there's some setup here, understanding basic software.